All of us that have had a cancer diagnosis, a serious illness, or a loved one that spent an extended time in the hospital know how challenging it can be to navigate the healthcare system, as well as find the information answers you need. With over 42 years of oncology nursing experience, Cindi Cantrell is an expert in navigating the healthcare environment and is here to help us learn how we can be our own advocates. Cindi is the Director of Cancer Support Services and Patient Navigation at Sutter Pacific Medical Foundation in Santa Rosa, California. Cindi is active in nursing leadership at national, international, and local levels. She was a founding board member of the Oncology Nursing Society. She has been dedicated to the patient navigation role since 2001, when she established a freestanding cancer recovery and resource center in Bozeman, Montana. Cindi received her nursing degree from Merrimack Community College, a bachelor's degree in psychology from Lindenwood College, and a master's of public health from the University of California, Berkeley. She has received a number of distinguished awards, including the Biden Fierce Award 2018, Oncology Nursing Society's Lifetime Achievement Award in April 2016, Cure Magazine's Extraordinarily Healer Award in 2014, and Oncology Nursing Society's Distinguished Service Award in 2010 for novel work in patient navigation. She has published over 12 articles and authored several book chapters, and is co-editing the third Oncology Nursing Society book on patient navigation. Following Cindi's presentation, we encourage you all to take a break, but also want to invite you to visit our vendors at the virtual resource fair. Live people are waiting to talk with you and share information. Without further ado, please welcome Cindi Cantrell.
Good morning, everyone. Thank you so much for being at this wonderful conference. Thank you, Bay Area Connections, for inviting me. It's truly an honor to be with you all this morning. The title of my presentation is really going to be about being your own advocate and navigating our current healthcare environment. My goals really are to look at the definition of cancer survivorship. And the reason I wanted to bring this about is to explain that there's been some controversy about survivorship, which we'll go over in a few seconds, and really discuss the strategies of self-advocacy and being heard, planning for realistic self-care, and defining resilience and hope. In the lower right-hand corner is, yep, I think I'll try to brand a few doggies today. So we've got a big agenda to go over. I wanted to give you a context about Survivor because I've been an oncology nurse. I've been so fortunate and blessed to go on my almost 45th year in oncology nursing. And I was blessed to be a part of the initial National Coalition for Cancer Survivorship when they came up with the definition of a cancer survivor. Coming back from decades ago where patients were considered victims, the cancer survivor movement really defined through NCCS, really defines an individual as considered a cancer survivor from the time of diagnosis through the end of balance of his or her life. It was expanded to include family members, friends, and caregivers who were also impacted by the survivorship experience. So often in a small rural community where I worked many years ago, the patient would become a survivor, and yet the people in the community loving and caring and friends or working with were survivors of that particular patient's experience. So it's a little bit of context, I think, that looks more embracing because we're all impacted in some way by someone we care for or care about with cancer. The National Cancer Institute defines the survivor as the health and life of a person with cancer post-treatment until the end of life. I try to look at it from the beginning of diagnosis, but I think it's an important context to look at the different perceptions of survivorship. What is important is that it looks at the physical, psychosocial, and economic issues of cancer beyond the diagnosis and treatment phases. And survivorship includes issues related to the ability to get health care, which is truly a challenge, unprecedented, and follow-up treatment, and to look at the late effects of cancer, secondary cancers, and quality of life. I'm not going to read all of this, but I want it so you can read faster than I can speak. But I wanted to give you a context about my friend Suzy Lay. She is a 4-time cancer survivor. She was diagnosed with her cancer initially at Hodgkin's disease. She was a nurse in Vietnam and was exposed to Agent Orange and had Hodgkin's disease. She's had breast cancer. She's had thyroid cancer. She's had bladder cancer. She gives the way of looking at phases of cancer treatment and resilience. And I just talked to her the other day. She actually had a valve replacement that now is very successful in people that had initial treatment for Hodgkin's disease or breast cancer, where they had radiation therapy, and as a result needed some follow-up cardiovascular therapy. So probably one of the most influential things that happened was really from cancer patient from the National Cancer Institute that really looked at the Institute of Medicine recommendations, where they really called out survivorship as a distinct phase of cancer care, and that we need to use evidence-based guidelines for clinical practice, and to increase the awareness of late effects and the need for survivorship care, improving access, providing professional education and training, which we're doing now, and increasing research to prevent or ameliorate late effects, and creating individual survivorship plans. It's clear that we need to look at the quality of life model applying to cancer survivors. We need to look at all those domains with respect to social well-being, physical well-being, spiritual well-being, and psychological well-being. Yet the current reality for oncology patients today is that there's a data overload, internet, social media. Many times patients say to me, I don't know who I'm supposed to call. I'm being cared for by a medical oncologist, radiation oncologist, my internist, my family practice, my OBGYN. Who do I call? And a lot of it is trying to figure out bombarding with the information and how you handle what I call information toxicity. Fear, anxiety, and stress currently in this pandemic has yielded a difficulty in terms of it's harder to cope with all of the things that are coming at us. Getting lost in a system, huge impact, as you all well know, about the financial toxicity. A few years ago, I was attending a conference where the head of the Patient Advocate Foundation was talking about the out-of-pocket costs for a cancer patient, not included by insurance, not covered by insurance, is about $9,000 a year. So we've got a lot of work that we need to do to try to deal with the financial toxicity. Who's the patient's point of context? And I certainly did not mean this as a flippant way of, am I going to die and where do I park? But that was really a patient saying to me, this is what I'm facing as a young woman with breast cancer. Where am I supposed to park? And, where am I what's going to be my outcome? So there's existential and practical changes that we need to face. So what is it going to take? I think we need to challenge the traditional medical model. The medical model used to be that when I started in cancer nursing, it was a medical model looked at you were considered a survivor or cured if you, from treatment, went out 5 years without a recurrence. We need to start to look at that very differently. We need to look at the gatekeepers to healthcare services, how we blend the best of Eastern and Western medicine, how we really collaborate with those non-oncology providers to provide needed service. Therapists, nutritionists, physical therapists, mental health therapists, social workers. How do we really look at those people that can help us? And looking outside the current traditional roles of healthcare providers. If we have enough time, I'll talk to you about some of the things that I'm doing with respect to equine facilitated therapy and how it's made a huge benefit with many patients. This is a slide that was a long time ago, but it reminds me of the media of people saying, well, I want that drug where they're sitting in the bathtub on the edge of a cliff, or they're sitting tiptoeing through tulips, so to speak. And it's just a way of looking at the media portrayal of some of the drugs that we know clearly are causing some horrific side effects in many cases. One of the most key factors is really for one to own their own voice. Because oftentimes, if you look at from the provider's perspective, their goal is to cure or control as best as they can with the evidence-based guidelines and treatments that they're incorporating. That may not necessarily be the patient agenda. It may be, how do I balance out my quality of life and treatment? And how do we have this dialogue so that these arrows, instead of looking this way, look this way? The patient voice is really the most significant part, because it's a partnership with your provider. So deciding what you want to know about your prognosis and treatment. Goals have to be made together with your treatment team in terms of being realistic. What is it that you want? Short-term goals and long-term goals need to be established and modified as time goes on. And I always tell people, what you feel is real. Don't let somebody pat you on the head and say, oh, this really isn't the way I'm seeing this, because you are the one that's experiencing what you're experiencing. And it's incumbent upon us to listen, and as well as empower voices. And be honest and proactive about symptoms. One of the things that I was realizing when I was caring for patients with metastatic disease is that they were afraid, if they really talked a lot about some of the side effects, that they would get a dose reduction. So it's really being honest with you, with what you're really feeling, and how you can incorporate, how you can speak that language to those prescribing your treatment. And actively engaging in online communication. The provider's goal is to really look at evidence-based treatment, prolongation of survival, reduction in symptoms, and really balancing that quality of life with side effects. What patients value and need, and I understand I'm speaking to a mixed audience, but I think what's really important is that what we as healthcare professionals need to recognize is what you, patients, and those of us caring for you, need to look at consistent attention to quality of life, pain management, symptom management, talking about not wanting to, patients say, well, I don't want to bother my provider because I'm afraid I'll be looked at as a complainer. I think what's really helped tremendously is online communication and telehealth. It's made a huge difference in many ways to patients, because they're able to reach out and email in the middle of the night. I highly encourage you to get online in terms of your electronic health record and communicate in that way. Patients need and want to be listened to regarding symptoms and side effects. And within reason, sufficient time with the oncologist or other members of the treatment team, especially for patients who may be having difficulty disclosing what they're feeling. So navigating post-treatment, who will help you? One of the things that I'm mindful of is that there really are no benign therapies, in the sense that there's always a potential side effect that one needs to deal with. Sometimes for those patients that we treat that may have secondary cancers, what's important is who is going to be responsible for watching out for consequences, for what our long-term side effects are. I was so blessed years ago to be able to work as a volunteer at Can't Make a Dream, which is a program in Montana to deal with young adults. And I had such an insight into 20-year-olds that were entering college and having cognitive disability with respect to, maybe they've been treated as a child with brain irradiation or some of the types of therapies that really impacted cognitive function. And one of the things I would recommend is that they, when they were going to college, to basically tell people, engage in those learning labs where you can honestly be aware to be able to say to your instructors, I'm having a problem. Can I learn this way? And it's really been a wonderful thing to see some of the studies that are being done on young adults and how that applies in terms of who's going to manage post-treatment side effects. Patients say, I may look like I'm back to normal, but I'm really not back to normal. So how do I deal with that? Planning for the future, what our providers need to do, and including myself in that, to know and understand and assess risks associated with treatment, establishing relationships and facilitating referrals to resources, and survivor patient family education to look at adherence and supportive care measures and early recognition of potential concerns. What can survivors, you as survivors, do? I always liken it to establishing a personal board of directors. Who can parse out what for me? Utilizing things like Caring Bridge, utilizing things like online support, utilizing being able to ask proactively. You can't expect necessarily your provider to be all those things that we would want them to be. Their goal is really to cure or control. Our goal as supportive people really needs to be to support you in your voice, finding your voice, helping keep a treatment journal, seeking second opinions. You need to be advocating for yourself with that and calling that out to your providers. Proactively organizing your questions and concerns. Unfortunately, many primary care providers are only having 15 minutes with someone. One of the things that I am so encouraged about all of you being here is it really looking at the advocacy groups, of which Bay Area Connection is all about, in terms of speaking up, speaking out, and speaking for others. I like it when I'm able to set my intention every day. I mean, didn't mean to be flippant, but I wanted to just say that I wake up every morning and think, how can I be of service to oncology as a world? How can I be of service to those impacted by cancer and those serving patients? So it's just a little humor for a second. I think in terms of advocacy, one of the things that we need to look at is how we allow others to nurture us. And I mean this very sincerely, being your own best mama. And I learned that from a woman who is a breast cancer survivor. Her name is Edith Iger, and we lost her not too long ago. She told the story about her ability to be her own best mama because she survived the Holocaust and actually went to the Holocaust Museum and saw a picture of her. And she remembers a soldier pulling her out of an abyss. And I won't describe it. It's pretty graphic. But she realized that she had to be losing her parents. She realized that she had to be her own best mama. And I think when you think about nurturing and you allow yourself to think about that, how you want to be treated, how you want to be loved, how you want to be cared for, is incumbent upon all of us. I think it's important to seek out others who understand and have knowledge. As we talked about, Bay Area Connections and national advocacy organizations are critically important. One of the most provocative books I read recently was Everything Happens for a Reason and Other Lies I've Loved. Is written by a woman with advanced cancer. And the book is really a very provocative and very personal role of how she started thinking and stopped thinking about certain meaning, existentially. Why did this happen to me? How did this happen to me? But really transcending that and saying, what do I need to do to face how do I face this? I think a lot is reimagining hope in the sense that you're going to be looking at, what does hope mean to me? Is hope mean that I'm going to be cured? Is hope mean that I'm going to be able to manifest a journal for my children? that when their 16th birthday, they can open a card if it doesn't look like I may transcend this disease. It's really about what hope means to you as an individual. The joy of giving back, being a volunteer, helping at a retreat, gives people a sense of meaning outside themselves. This is a picture of someone that I did retreats in Montana, and someone that felt like just being a volunteer and giving back, kind of like the pay it forward attitude. I put this slide in here on purpose because I did an equine therapy retreat, and one of the physicians this patient was 75 years old. And one of the physicians called me and said, "I can't believe you invited her to the retreat." And she said, "Do you know how old she is?" And I said, "Yes." And she said, well, I said, the goal is not for her to be an accomplished equestrian. The goal is for her to experience joy. And one of the cute things about her was that we had cups made with pictures on them, and she was doing the Queen's wave. And one of the cups, she said, "I want an extra cup printed so that I can give it to my oncologist, because I'm 75 years old and I really did learn how to ride a horse." Resilience. Resilience is really defined by an ability to adapt to a traumatic event. And clearly resilience has been in the forefront of everyone during this pandemic and during trying to navigate cancer therapies in the midst of a pandemic. You know, it's interesting because this is the first year in 5 years that I haven't been evacuated and trying to triage patients for fires in Northern California. And one of the things that I realized very quickly during this pandemic is during the fires, I could actually watch, or you could actually get on the news, and you knew ideally there was going to be an end to it. With the pandemic, I think all of us are facing personally and professionally the fact that we're in this for a long haul. And so how do we learn to adapt in the face of adversity? Speaking of, seek a belief for spiritual practice, and I'm not talking about necessarily organized religion. I'm talking about what gives you strength, what allows you at the end of the day or the beginning of the day to focus your intention on what you believe in and how you can manifest reasonable goals and realistic goals. And really that safe place that you can go to when you're frightened or when you're scared or when you need strength. Self-care plan. We talk about this all the time, but I think that one of the things that has been very helpful from what patients have told me is to look at what you can do to set your intention every day. Back to one of my slides on the coffee cup, what you can do to set your intention every day. What am I going to do for my mental health? What am I going to do for my physical health? And what am I going to do for my emotional health? Renee Brown I'm a huge fan of hers. And I thought this was really an important message to call out. Her message in terms of recognizing our individual gifts of imperfection. So what do we want to focus on? Authenticity, letting go of what people think, self-compassion, letting go of the perfectionism, having a resilient spirit. I want to cultivate gratitude and joy, and intuition and trusting faith, letting go of the need for certainty, creativity and letting go of comparison. Why is this happening to me? Why is it not happening to them? Play and rest, letting go of exhaustion as a status symbol. I think we all realize that this pandemic and any other kind of challenging trauma, so to speak, really helps us refocus on what's important to ourselves and where we really want to be and what we really want out of our life. And as Dr. Larson talked about, that letting go of anxiety is a lifestyle. In meaningful work, letting go of self-doubt and the supposed to, if you will. Reflection. I love this slide because it's a continual evolution of looking at what we see on the surface and what we may feel below, or what we may feel inwardly. And to really give time to reflect every single day, I think is an important part of our own mental health and our own resiliency in terms of how we reflect on things. And knowing yourself, understand what triggers PTSD. Knowing that, for example, before years and years and years ago, before we came up with the great anti-nausea medications that we have right now, I had to be very careful as an oncology nurse, even in a small community, grocery shopping, for example, because people would associate me with their treatment. So I had to be very mindful of what triggers are apparent for people with suffering PTSD. Knowing what it is that's going to bother you, knowing what those triggers are and trying to avoid those at all possible, I think are clearly very, very important. And Jeanette, if you're on, I realize that we lost a lot of slides. Or Jonathan, if you can hear me, I know that there were a few slides that I don't see. Did that go on while I wasn't able to be on? Okay. And with this, I'd like to just give you some time to ask questions. One of the things that I realized when we had a little disconnect there is that I think one of the things that's really important for you to think about is the journaling and preparing. If I could give one take-home powerful message in advocating for yourself, it's trying to focus your questions and trying to focus what I want out of this particular follow-up visit, or what I want to know in preparation as much as I can in terms of dialoguing with the professionals and dialoguing with people that you're going to be having a communication with. Taking your cell phone, recording the conversation, recording what the providers are saying to you, writing things down, being able to communicate effectively, and actually prioritizing your questions as best as possible. And again, looking at what you can do in terms of your own, taking someone with you, seeking a second opinion. All those things are critically important in how you advocate for yourself. And I hope that there are certain things that we've learned about telehealth that are going to be applicable for a very long time, because I think that a lot of patients have really benefited by not having the long commutes that they often have, and being able to do the telehealth component, I think has been a benefit of actually what we've been forced into very quickly with this pandemic. So at this point, I think I'd like to just turn it over for questions.
Okay. Thank you so much, Cindi, for that wonderful, very thoughtful talk. I'm sorry that we've lost some of your slides if that's the case, but we now have plenty of time to address the questions. So if people do have questions, feel free to enter it into the Q&A box, and I will answer them as they come in. So we do have a couple to start with, Cindi. One of the first ones is, could you please provide tips on how to manage friendships during treatment, especially when you're a patient who lives with cancer as a managed disease?
That's a great question. I mean, one of the things that from my experience, and I'm really a tapestry of all of the years and years of working with patients. So I really am a tapestry, if you will, of things that patients have told me and things that I've experienced that have happened with patients and in their lives. And I recognize that there are angels that are going to come in your life when you're diagnosed or when you're going through treatment that you never anticipated would come into your life. There are people that you thought that you could count on 100% who all of a sudden disappeared. So it's really about being comfortable with asking what you need, and also having an opportunity to really reflect on, if somebody's being toxic in not helping me, then maybe that's someone I don't want to spend a lot of time with. I did a support group a few years ago, and one of the patients said, to me, Cindi, I channeled you. And I said, oh gosh, that's kind of scary to think about that. And she said, I was at the grocery store and I decided I just didn't want to wear my wig and I didn't want to wear a scarf. It was hot. And I said, I'm just not doing this. And she said, of course, we all know the look. You're checking out and somebody's like, oh, you poor thing, you're lost your hair. And she said, the person checking out her groceries said, well, my aunt had blah, 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 blah. And it wasn't a good conversation about what had happened to her aunt. And she said she put her groceries in and she wheeled the cart out. And she said, I channeled you. And I said, oh gosh, what did you do? She said, I went back in and I very politely said to her, please don't ever say that to anyone again. You're making an assumption and your conversation wasn't helpful. I'm sorry what happened to your aunt, but please don't lay that on me. Please do not say the negative component. So in terms of the question relative to friends, it's really going back to almost being your own best mama. Like, what is it that I need to feel supported, to feel cared about, to feel loved? It's not your responsibility to necessarily deal with their feelings. It's one's responsibility to deal with your own feelings and feeling safe enough and powerful enough to state to others what you need. Hopefully that answered your question.
That was a fabulous answer. I love it. And maybe now we can all channel our inner Cindi when a situation like that arises. We have another question about advocating for oneself. If you are a patient and you want your doctors to use the latest and greatest therapies, in this situation, the participant is asking about immunotherapies for the treatment of their cancer. How do you suggest that people advocate for themselves to their doctors?
So I think it's about educating yourself. I mean, what is really critically important is for you to utilize those things relative to cancer.gov, clinicaltrials.gov, looking at what you're in. And the other thing is that NCCN, which is the National Comprehensive Cancer Network, has evidence-based treatment guidelines for patients. So let's say I have a rare tumor. Let's say I have a mucinous adenocarcinoma of the appendix, for example. When I was a freestanding navigator in Montana, there was a patient that presented with that. So we went online together and we basically found the best treatment for her was in Washington, D.C. So she did her own research in terms of being able to be knowledgeable enough to say, I want to explore this. Can you give me the pros and cons? And how can I at least understand if that's a treatment option for me? And I often tell patients, if you feel some reticence or you feel some pushback, and it happened particularly in rural areas, that you feel like you may offend your oncologist for a second opinion, you have to let that go because you are fighting for your life and you have every right to seek out as much information as you possibly need to make an informed decision. My experience is everyone will be able to make a decision. It's what information they need to feel like they can make that solid decision. And one other thing that's a little diversion from this is this particular question really has to do with how do I manage anxiety? Like, let's say I want to go to, let's say I'm newly diagnosed or I'm facing potentially a recurrence. What I often tell people is that feeling of your palms sweating, your heart racing, your difficulty in breathing, trying to catch your breath, that dissipates. When someone is first diagnosed, it feels like it's 40 hours a day, 9 days a week, 400 days a year. And the intensity by which you feel that anxiety and the intensity by which the duration of that anxiety all dissipates. That said, allowing yourself to feel what you feel is critically important. Pushing in a way that I should have hope, I should have this, I should have those shoulds, I want you to rethink. Because that's not, I know that if you allow yourself to feel, you can't heal what you don't feel. And so allowing yourself to feel and feel empowered about, back to the original question about, looking for a clinical trial or looking for immunotherapy. The good news is that so much of this is online. Now, you may not be a candidate for a particular treatment, but you know enough about to explore whether or not you are. Hopefully that answered the question. I got a little diversion there, but I wanted to say that at some point in time during this presentation.
Yeah, thank you. That's wonderful. Do you have any advice specific to dealing with scan anxiety or like appointment fatigue?
Yeah. So scan anxiety is real. I mean, it's like after people go through particular scans and they're okay, anymore. And I think the scan anxiety is preparing that you know you're going to have it. Like accept that that's going to happen. And what is it that you can do to prepare yourself for that? Like, let's say it's, hey, I'm going to go out to lunch after the scan. I think the most critical thing is to know when you're going to get your results. People can face anything if they know what it is that they're facing. It's the unknown part that's so terribly difficult. So, you know, it's okay for you if you go back and get a CT PET scan, or you have a ultrasound, or you have whatever, to say, when can I expect my results? One thing that is really important to know is the Cures Act came into effect in April of this year. And what the Cures Act does is requires by law your results go into your record real time. So sometimes it was the doctor had to release your results. The only thing that's an exception to that release now is not, you know, it's a drug screen, or it's a HIV, or it's a mental health issue, or whatever. So you'll be able to see, back to scan anxiety, what you need to know is your results as soon as possible. And the Cures Act has mandated that healthcare systems drop into your record your information.
Just one more thing with regarding to that. I've found in my interactions with clients that sometimes they're able to access their results very quickly, but they don't understand them.
Right.
Well, how do you suggest people deal with that when they may not have immediate access to their doctor upon seeing those results?
Well, I am a tremendous advocate for navigation, nurse navigation, or a social worker. Anybody that, I think if you find those really special people that are everywhere in our care system, they may not have the official title, but they're going to advocate for you. So I think it's finding that person that you can say, well, who can I contact? If I can't get into this portal, or I can't get into this, who can I contact? Because in fairness to the physicians and the nurse practitioners and all those licensed providers, they may not be able to manage their time of information toxicity. So it's, well, if you can't respond, is there someone else that can help me? The medical assistant, the front office person, you know, those people are really critically important in helping you. And then identifying, what does this mean? I mean, I think that's the downside of the Cures Act, where you'll get a report and you won't know how to interpret it. That's the biggest issue I think that people have. And I've done a lot of research on how to, it's not just a matter of getting the results, it's who explains this to me. And I think to try to find that out is going to be predicated upon your care system and where you are. But finding out who you can talk to is a very important part of your whole care plan.
Absolutely. And I think it's a challenge that many patients deal with. Another question, which I think is very relevant, is how do you manage your care when you have so many different doctors that you're dealing with who aren't necessarily communicating with each other?
You know, I can't emphasize enough how difficult that is for people. I remember it was so long ago, but it's still etched in my mind. This woman was talking about my child. Her child had a childhood cancer. And she said, my child is being cared for by 9 different specialists. And yet I have no idea who I can call. I don't know who to call. So I think it's a matter, and that's the other part about survivorship as well, in the sense that you will have a flu after treatment. is, and your immediate go-to is going to be, oh my gosh, do I have a recurrence? Or, oh my gosh, this is something other than the flu. Well, now with COVID, that's probably not a good analogy. But I think it's about still establishing your contact with your primary care provider, who really should be the hub of your wheel, referring you to all specialists, but they can be the ones that can really help triage your questions. My concern is that we're not to the point where the primary care providers are empowered enough to have the skills and knowledge to manage long-term side effects or long-term effects of treatment. So admittedly, that's something that we all have to deal with in the oncology world. We have to somehow empower people to be more knowledgeable about, for example, pediatricians have got it down pat in the sense that we know that children that were treated with brain irradiation, and when they go into the 5th grade, they're going to have very specific mathematical computation problems. And we know that because they've managed those side effects for so long. And yet, many pediatricians have told patients, or at least what patients say to me, I'm 21 years old and my pediatric oncologist doesn't want to see me anymore because they said I'm 21 years old. So it's about how you find out who's going to be managing you long-term, and more importantly, who has the knowledge. So I don't have a direct specific example because it's all so individualized. But when you've got 9 specialists, my go-to would probably be going back to your primary care provider, because what's going to happen is potentially the radiation therapist will say, well, that's not a side effect of radiation therapy. That's a side effect of this. Speak to your medical oncologist. The medical oncologist will say, that's not a side effect of cytotoxic therapy. You should see this. So whoever is your hub, whoever's the hub of your wheel is who I would recommend you go to. Does that make sense?
Yeah, that makes a lot of sense. And I think that hub may change over time. During active treatment, it might be the medical oncologist, and years later, maybe it's the primary care. So, yeah, thank you for that. We have a question from the audience regarding PTSD. Can you speak to the prevalence of PTSD in breast and ovarian cancer survivors and how to handle the triggers?
Well, I think that one of the things that's important for even you being here and listening to this whole conference is going to be a way to ameliorate some of your PTSD. And I'll tell you why. We know that we learned a lot about PTSD from Vietnam vets, where if they were allowed to be in a safe, supportive, instructional environment and could dialogue about what their trauma was with people that they trusted, there was a healing component of that. And so support groups, I see that Dr. Spiegel, who has an extensive legacy in dealing with support groups, finding a support group, finding an online support group, being able to re-experience your trauma with somebody who understands and will witness it. It's not about giving you advice. It's not about a situation where, oh, you shouldn't be feeling that, or that's not real. That's not what healing PTSD is all about. It's recognizing, back to the other question about scan anxiety. It's about what potentially might trigger me, and what can I do to acknowledge it and figure out if there's a way to deal with it. So, for example, some patients have such anxiety that they may need to take some medication and have someone else drive them for the scan. Or they may need to think about scheduling it at a time when there's going to be support. Like, for example, getting tests, it's always the challenge of, do I really want to have something done on Friday? Because I'm going to have to wait the weekend and for the results. And there is a cadence, almost an environmental or energetic cadence about having things done in the middle of the week, as opposed to having things done where you might have to wait because you seemingly don't have as much access to the healthcare professionals, for example, on a weekend. So PTSD we know a lot about PTSD. It's about identifying what your trigger may be, talking to other people about what you experienced, witnessing that, having them listen to you and not minimize what you're experiencing, and then coming about with some potential tangible things that you can do to deflect some of that. You can't necessarily avoid it. Back to the fires or back to whatever. Every time I smell smoke being evacuated 5 times is it that I know that's a trigger for me. I recognize that's a trigger for me. And so I just have to be mindful of that and check out my environment and make sure that things are safe. It's the same kind of thing of being mindful that there's going to be potentially going to visit the doctor is going to bring up some things again, potentially may bring up some things again. And I think really exploring the having people around you that understand, really truly understand what you're going through.
Thank you. That was a really great answer. You mentioned a few times about a survivorship care plan, and a participant wonders, is that something you could request a concise summary of their cancer care across providers or departments? So maybe just talking a little more about what a survivorship care plan is and who might be involved in creating one.
I am so excited you asked that question. Thank you so much. That was something that I thought I had missed. So actually, ASCO, the American Society of Clinical Oncology, and you can actually Google ASCO, ASCO, Survivorship Care Plan. So when you are beginning a cancer treatment, it's knowing about what those side effects are, knowing what those drugs are. What everyone should be getting at the end of treatment is a treatment summary plan. And you can start doing it yourself in the very beginning. Create that notebook or that online portal for your own self or your notes or however you keep your, some people find it helpful just to keep a ongoing big calendar or they're all around notebooks in terms of mapping your journey. But what a treatment summary plan is, this is the treatment you had. These were the doses you had. This is when you should have your next scan done. This is what your follow-up should be. This is when you need another mammogram. This is when you need another ultrasound. This is when you may need another blood marker, tumor marker test, so that you know in one place what has happened to you. You physically feel it, but you need to have it documented. And I would suggest that you document that in a place that's mobile with you. For example, one of the challenges as a navigator in the old days when people had analog mammograms. I remember this patient, I said, can we get your previous mammogram so that I can get those scanned in your record? She kind of looked at me with a blank look and she said, oh, I had the films. This is old, probably for a lot of you don't remember there were actually films, but there was films that basically, she said, oh, they were in the back of my car and I sold that car, or they were in my trunk and I sold that. So whatever you do, keep it mobile and keep it in multiple places. But a treatment summary plan is what treatment you had, what drugs you had, what doses you had, and then what the follow-up plan should be. And you can ask for that. That is your right. You're entitled to that, absolutely, without question. And sometimes I've done work, and I'm happy to do this at any point in time for anybody. Look at really specifically creating your own notebook. We did that in support groups where we would really sit down and say, okay, what do I need to bring with me? And I would literally help people organize their whole trajectory in one place. It's kind of like back to the question about who do I talk to? If your primary care doctor or someone taking care of you has a history of the treatment that you received, that helps. And they don't always necessarily, medical records, as you all know, don't necessarily always talk to medical records. One institution's medical record may not interface with another institution. And because we need to be able to have access to multiple specialists in different care settings, it's important for us to own that material, if you will. own that consultation note, and you have every right to ask for that.
Perfect. Thank you for those very practical tips with ASCO and a notebook and all that. Appreciate it.
And just Google a treatment summary plan. ASCO has one. There's a lot of different, I can't remember what the initial one was that was out, and they've modified a lot, but it can be as simple as 2 pages. Or it can be as simple as, looking at yourself. Okay, what were the drugs I had? You can look back on that and organizing it in one place. I've seen situations where it was lost. So someone's going in for an appointment at a different facility and a scan was done. And I always want to empower people to be prepared if they're going to go to see someone else. They may not have it in their medical record, but if you have a copy of it and you've got a hard copy and a digital copy, then you can give that to them. It saves a huge amount of time. It just happened the other day with a patient that had a COVID test someplace else and was going in for a procedure, but that where they were getting the procedure didn't have the results of that. I said, just go online, scan it into your phone, scan your vaccination status into your phone. So that you've got it in one place rather than trying to reach somebody who can fax that or email that to where you are, if that makes sense. The same kind of thing, only it's about having it in one place and having easy access to it.
Absolutely. And I think our phones and technology have made that a whole lot easier than it used to be. With that, I want to thank you tremendously, Cindi, for your wonderful talk and addressing all of these questions. I want to thank the audience out there for listening and participating actively with the questions. If you did not get your question answered, I apologize that we've run out of time, but feel free to contact our helpline, and we will do our best to address it through our information service. So it's now time to move on to the resource fair again. If you haven't had a chance to check it out, you can access it through the landing page. Or perhaps you're ready to get up and stretch and move a little bit and grab something to eat, refresh yourself. And the next talk will be one of whichever breakout session you chose. You can log on to after we have the resource fair again. So we'll see you soon.
Thank you. Thanks, Bay Area Connections, for sure. And keep your faith and keep your hope and keep doing what you're doing.
Thank you, Cindi.
Ladies and gentlemen, that concludes this morning's plenary session. Please enjoy your lunch break. Also, be sure to take advantage of this time to explore the resource fair. There's so much to experience at the resource fair. This year, you can visit live with the folks at the fair, ready to welcome you as you click your way to their booths and the links within their booths. We will see you this afternoon at the breakouts, beginning at 12:35 p.m. Enjoy.